Hey Cam followers, it's Sunday, it's 7 p.m. and we have Colin Whiting with us tonight. I'm really excited about this because Colin has got quite an outrageous personality. He'll probably have me in stitches and I'll have to leave the room. He's a vet who's going to introduce himself because he's got quite a decent biography and I'm not going to do him justice. So just tell us a bit about yourself, Colin.
That's a hell of an intro. I've been a vet for 22 years. My journey, if you like, as being a vet started off as a spotty 15-year-old teenager in a very supportive mentor's consult room, and he sort of introduced me into the profession and playing carpet bowls with fairly equal time spent on each. I really enjoyed myself at university, possibly enjoyed myself a little too much, staggered around with some pass marks. But since going into practice, kind of found more my feet of what I was interested in professionally.
So at university, were you a bit like me, where you just got through? You kind of you never really shone like the shining star that you wanted to be.
The word is wastrel. There are very few exams, if not possibly all of them, in the first 3 years when things were a wee bit dull, that I didn't have a second crack at, and sometimes a third.
Yeah.
But when stuff got a bit more relevant and more interesting, then things perked up a wee bit.
I think people don't realise. Okay, so just so the Cam followers know, for you to train as a vet is either 5 to 6 years. And it's a pretty intense course. So, you know, three terms per year. Every year, at least, there's exams. Quite often, there are exams every term. And when I went to uni, we had our academic tutor, a personal tutor. You had your lectures. You had, oh my god, it was so much. And yeah, it was.
Yeah. It is a really rigorous process, and I think it's common for most vets, particularly if they're just much better to practice life. But the contrast of the first 2 or 3 years, it's a bit dry, it's a bit dusty, it's anatomy, it's physiology. There's not that much singing, dancing, and leaping around in terms of the lectures. But it's stuff that you need to know, and it provides the foundation to later on when things get more applied. And that's when I found learning a lot more interesting, and then kicked on with it afterwards a wee bit as well.
Yeah, because you said that you left uni and you very quickly went into doing a certificate, didn't you?
Yes. Yeah, I did the certificate in small animal surgery. I started that after a year in practice, registered for it, and it takes 2 or 3 years to move on through, and I got that 2003, same year I got married.
And then you very quickly threw yourself into a role where you were leading the surgery and just going, I've just got to get on with this.
Yeah, I mean, in the practice I worked, I did spend a year back at Liverpool, being trained in some of the procedures, which was really helpful. And I came across some really passionate surgeons as well, through passionate about teaching, particularly through some CPD courses. I went to a series by Mark Glyde, and the guy, he just oozed wanting to communicate through lectures, practicals, whatever. And he and his colleagues would sort of talk about techniques like epidurals. You went to one of his weekends and you come away absolutely burning to do an epidural in your next patient. And it's sort of invigorating, empowering stuff like that. And so I took some of that back into practice a wee bit when I worked up in Cheshire, and then moving down to Cornwall.
Yeah, so you're in Cornwall now, and is it a private practice still?
Yeah, well, worked for 12 years in setting up a referral practice, and we expanded the small animal practice. that we joined with a corporate group about a year and a half ago, and so I've moved on over the last 3-4 months. Instead of being on call 24/7, taking a bit of a break and being on some school rugby touchlines and school pickups and things like that. Yeah.
Oh, nice. So tell the CAM followers what kind of level of surgery that you were doing on a regular basis, so they can just put you into the zone, so they know what you do. What kind of surgery?
I did predominantly orthopaedic, but spinal and some soft tissue surgery. So we would very regularly see cruciate repairs. Particularly, I did TPLOs for. I'm a big believer in doing bilateral TPLO and fracture repair, spinal decompressions. We had CT scanner at the practice, so that helped us finding out location of spinal issues, and various soft tissue procedures as well that would be referred in. Yeah,
that's heavy stuff. So CAM followers, to be competent spinal surgery, that's kind of, wow, very impressive. But we're not going to talk about that today. But if CAM followers think he's incredible, and please come back and let's do a little bit of a talk about surgeries and decision making, we can do that. Today we wanted to talk about something that applies to everybody, and not just the client, but also the vet, the nurse, the receptionist, because we as a profession know that a lot of misunderstandings, complaints, misinterpretations happen because of communication.
Yeah.
What we thought we could do today is focus on how the owner can maximize their consult and get what they need, and how they can get the best out of their vet. But also we're hoping for the vets that are following this page that Colin's going to impart some knowledge about things that he's learned to do over the last 22 years, which has maximized your consultations to give owners what they want. And I know what you do works, because when we put our first post up about this, you had a flurry of owners from the past come forward and say, thank you so much, and this was going back a fair few years.
Yeah, there's a couple from 10 years ago. It was yeah.
Yeah, and that's amazing.
Yeah.
So let's make sure that you leave those gems for us. So let's kick off, okay? Let's going to start right with the owner.
Yeah.
In practice, they've got a dog who's getting stiff and getting old, and they've been aware of it for a bit of time, and they know they've got to go to the vet. What sort of things would you suggest to them that they should do in preparation for that vet visit? And what sort of things do you think should happen whilst they're at the vet? Just kind of talk through things that they could do to maximize that time.
Cool. The first thing to say is do it.
Yeah.
Because I think it's so easy to be sat at home and to see the issue, and it's almost acknowledging the issue is picking up the phone and making the appointment. Yeah. And a lot of the cases of arthritis, it's not a sudden onset. It's not a dramatic sort of, oh, this has happened. If a dog falls over and starts limping or bleeding from an ear, owners are straight on the phone. It's a trigger, it's a call to action, it's straight away, it's imperative, and it's now. Whereas if you have something that's just a gradually building problem, then you can kind of accommodate it to it at home. And you have phrases like, well, he's getting on a little, or it's not quite as speedy as he used to be, or, well, we don't take the long way around the park anymore, we just do the other, and he's happy with that. And all these sorts of phrases are accommodating phrases, or ones where we're naturalizing that there's a change or an issue, and it's quite a gut instinct, I think, for most, you might call it the British stiff upper lip, if you like, to not make a fuss. Yeah. We don't, or the majority of people don't like to run things up a flagpole and scream for attention. They'd rather everything was just settled and calm. And if there's a reason or justification for something, and we can say we're just getting a little bit older or something like that, then that's fine. And it normalizes it and makes it acceptable. If you dollop on top of that an inherent feeling possibly of apprehension of what you're going to be told, I think there's an awful lot of owners out there who love their dog to bits, and they don't want to put themselves into an atmosphere of possible peril where someone's going to advise this big thing needs to be done, or this investigation needs to be done, or the owners at home know that their dog is relatively happy. They have an apprehension that they're going to be informed that something drastic has to happen here, an apprehension of medication or something like that. And so I would often find people either through the first opinion side or referral, they would come in, the client would be coming in, and they would be already trying to fight a battle or talk down a situation. So they might come in and say, well, we've got such and such. Well, the vet said I ought to come to see you, but I don't think it's anything too bad. I don't think we'll need surgery or anything like that. And it's a mindset. I focus a lot on the psychology in the consult room, but it's a mindset where someone's already kind of a bit prepped for it's me against you.
Yeah.
And it's entirely understandable. But it comes from a place of initial concern. And we spoke just before switching on the live about the white coat fever, and do we need to be sort of alienating or dance around on the superiority of where we are, whereas actually what we need to have people feeling is the same emotion that you feel if you've got a little bit of a problem when you're a kid and you ask your dad or your uncle or your aunt or your neighbor or something. We've got to be that sort of approachable, and clients have to meet us with that.
And I totally agree. I think a really good example, let's take pain out of this. Let's talk about another chronic problem that we know we need to do better on, which is obesity. And I know through my 19-year career, 18, 19, I can't remember. Anyway, when you have so many negative responses, you start thinking, I'm just not going to bother saying anything. Because when you have an owner, they do the face, the little razors come out their eyes at you. They become disinterested, or they get something out their bag, or they start talking to their child.
Big wall, big disconnect.
Total disconnect. And you just sit there going, this has happened like 50 times now in the last 2 years, and you almost start preempting that someone's going to do it. So you get to the point you almost don't put your heart and soul into it. So talking about the fat debate, because it's very relevant to arthritis anyway, we have, I think it's about 67% of dogs are now considered obese, 67%. We both, owners and vets, have got there together, and it's a communication thing, it's education and communication. Now, the same thing in my mind happens with arthritis, and I know this. When you say to an owner, oh, he's showing signs of getting quite stiff now, and I've just seen him have difficulty standing up. No, he isn't.
I think two things I'd like to put in there. First of all, and probably just mentioned, the second is going to be the concept of excess of love. But the first point, I think for vets and for nurses and clinicians who are seeing weight clinics and things like that, I found in doing first opinion practice, if you come across a dog in your run of consults and that dog snaps at you, then for the rest of those consults, for the rest of that couple of hour, 3 hour session, whatever, you're a little bit more suspicious, a little bit more wary, a little bit on your heels, because you've been exposed to it. And I identify completely with what you describe. it's really difficult for vets and for nurses to raise the, you know, the issue, if you like. I imagine it is for doctors as well. So we're kind of expecting, oh, here we go, bet this is going to be a bit defensive. And the client is expecting, well, I'd like to take him in for the ear condition, but I do not want to get a battering about his weight yet again. And so we're at the moment, you know, from the very off, we've both climbed in a trench either side, and we're trying to peep over into no man's land and expecting to get a headshot off on both sides.
Yeah.
So in terms of the veterinary faculty, the vet and the nurse, I think it's really important that we frame that obesity situation as an excess of love.
Yeah.
These owners are not starving their pets. They're not being mean to their pets. If anything, they are literally giving too much to their pets. I
think that's a nice way to put it.
If you've got a situation where you've got an owner who is being mean to their pet, it happens immensely rarely, vanishingly rarely in a consult room, because why would they bring a dog into the vet practice if they want to be mean to it? I mean, yes, people, RCVS, it's a situation that exists, but it's a situation that exists at home. It's reported, whatever. It's alien to the consult room.
Yeah.
Now, if you've got a situation where there is an excess of love flying around, it's there to work with, to sculpt, to redirect. And if you can be redirecting that and saying, well, look, instead of a biscuit, it's a nugget of carrot or a nugget of celery, or even better, a little walk round the block or something. Yeah. I mean, yes, it might be loved with a little smattering of ill discipline, and sort of, you know, we get a big personal sort of goodwill feeling from feeding and providing and rewarding and coming back.
I think also we're all so busy now. I think that's another massive problem on the obesity side of things. I have watched my own behaviour over the last few days. I've been very busy, and lovely little Loon has been with me, and I want her to be occupied. And I've been putting things in Kongs, and I've been throwing biscuits and hiding. And her amount of food she's eaten, because I've been busy, has been greater than if, you know, if I focus down and go, no, I'm going to allocate my time better. There's so many reasons that we overfeed. But going back to the conversation,
yeah, it can be an instant treat. It's an instant reward, isn't it? It's throw a little bit, break off a bit of your sausage sandwich, and there you go. But it's important we understand what place it's coming from.
Colin, you got your first heckler. Guess who it is?
McClement.
Yes.
Yeah. We are in Harry Potter. Yeah.
Broadcasting live from Hogwarts. Anyway. So, really good tip for vets. Immediately straight in there. Let's refer to the fat problem, the obesity problem. See them as excess love. Talk in that manner, because then you've got something to sculpt with. I love that. That's great.
But it's straight in. It is a big win, because here, a big potential win. Here is something that needs no diagnosis, medication, anything like that. Fundamentally needs no expense, actually needs less expense, to communicate to the owners, we can make such a difference to your dog by making him skinny. And so when I talk about all the options for the treatment of arthritis, and I put my hands up and count them off, there's the big things that go on one hand and the little things that go on the other hand, because often
you're going to do the 10 top tips on your own. If you're doing that, I'm not even going to be here when we do the 10 top tips.
But the thing is to communicate that actually the big things are simple and boring, and there's no sparkly laser or stem cell therapy or whatever. There's no £1,000 bills that go with the things that are most efficacious, which is counter to your, you would generally think.
Can I just stop you? Stop. That was why CAM was created, because there is so much obvious foundational stuff that doesn't cost anything, which means there's also money to be made out of it, because it doesn't cost anything. You can't make money out of it. Stopping your dog walking on slippery floors, stopping them jumping out of the car, stop throwing that ball, get the weight off. I can't make any money out of that. So it often gets neglected in the online world because a lot of people are trying to make money. So CAM was created to make sure that that foundational advice gets out there, and I'm glad that you said that, because that's really important.
Well, I mean, generally, if you go to, all the phrases, free advice is worth what you pay for, advice for free or whatever. You go to a car showroom, if you pay a lot of money, then you get a better car than if you pay a little bit of money. But a lot of, in the treatment of arthritis, a lot of the things that are very intensive, not all of them, but a lot of the things that are very expensive and intensive to do are actually far less efficacious than the holy basics. The very most potent thing that you can do for a fat arthritic dog is to make it into a skinny arthritic dog. Before you've done out else.
Can I use holy basics, please? I love the best thing I've heard so far. Hashtag holy basics. Catherine, but yeah, so okay, well, let's go back into this consult room. Now let's go to the vet's perspective. But just before, well done, Lynn. You're absolutely right. Take video clips. Well done, Helen. Take notes. Absolutely. Go in as the owner with as much information that is easily accessible, because time constraints are there, whether we like them or not.
Yeah. Video clips particularly, because dogs are powered with adrenaline. They're in an alien place. They will come sauntering in with an owner on the end of a lead, scowling at them. You're showing me up. I knew he wouldn't do it. I knew he wouldn't do it when he came in. But you can see that clip, and that clip, often that clip's going to be of the first few steps so they got out of bed in the morning, or they've been for a walk, had a kit in their basket for an hour, and this is how they are when they get out of there. And that's really important for us to see. Because the dog might be walking around normally for us there. He's limbered up and he's powered with adrenaline in a strange place, massively stimulated. And so a video clips like that.
A little tip, owners, just something from my perspective. Make sure it's readily available. There's nothing worse. 10 to 15 minutes and they say, I left the phone in the car, or it's somewhere in here and they're scrolling through 1,000 photos before they find the right one. Come prepared. All of us, and I mean this, I am sure that the majority of the vet profession wish that they had more time, and I know that owners wish they had more time, but the real truth of it is a business. It is a business and costs need to be covered, so there is always going to be constraints. I would rather be able to talk to my owners just indefinitely for as long as they like. It's not going to happen. So go prepared. Know that you're going to have 10 to 15 minutes. Maximize it. So well done. I've got a really good one here from Patricia Harford. So just before we go from the vet perspective, I would be happier if vets could offer a list of alternatives in treatment rather than just giving Metacam. Let's just talk about this, okay? I think there is a little bit of a belief in the public, and I think some of it's founded, that vets only prescribe non-steroidals and they don't really explain them, and suddenly the dog's on Metacam for life. There is an element, I can see that from the owner perspective. If communication was poor, if information to go home with was poor, I can see how that can be seen. And when CAM does our practice training, we really try to tackle this because it needs to be dealt with. As a vet, if I see a dog come into me, it generally is at its worst. So owners don't bring their dogs to us when their dogs are really, really healthy and there's nothing going wrong with them. They bring them when they're painful.
They're boosters. When it's
boosters, yes. But they bring them when they're painful. And if they're painful, I want to use something that I know is going to work really quickly. I know it's going to work reliably, so it's predictable. Because if it doesn't work, what else is going on? So I do use non-steroidals because they've got the most clinical evidence behind them. But I will also say, whilst we're using this, we're going to get the weight off, we're going to change the lifestyle, you're going to stop throwing the ball, we're going to do lots of other things so that our reliance on this non-steroidal can reduce, and hopefully we won't need it. But what I do really want to say as a vet is that dogs carry more pain than they tell you. So when I see a dog come in and the owner has observed pain, that's pretty bad. Because up to that point, they've gone, I can cope, I can cope, I can cope, I can cope.
Yeah.
So I do think, and don't take it the wrong way, Patricia, please don't take it the wrong way. I do think there's a belief that vets only prescribe non-steroidals, but I think it's because we know that they work and they work quickly. I think you're right that we should provide a leaflet of all the alternatives, be it physical therapies, supplements, etc. And I think we should give more education. That's where CAM comes in. But I know that vets use non-steroidals because of what? Add to that, sorry, me just.
I kind of live my life by analogies.
Okay.
I can never explain anything either without a pen in my hand or an analogy on the way. If someone's asking, if I'm detecting that a dog is in discomfort with arthritis, and that can be up to the vet to scout out with boosted situations as well. But that analogy for me, I've got a dog in front of me who's in pain with arthritis. Now, that analogy to me is like being with on a busy high street with an old lady who wants to cross the road. And there's a zebra crossing right beside us that is going to, as safely as possible, get us across that road to that goal. Now, there may also be an overflying bridge if you walk a long way down that way. There might be a subway if you go down that way and round and about the other side. We could phone a taxi to pull up and drive us along, do a U-turn and get us over to the other side of the road. That would cost a fortune and take a lot longer. But I've got that treatment option readily available, safe. Nothing is perfectly safe, of course. But the non-steroidals carry a vastly adverse rap as proportional to actually their efficacy and their safety. And I know that when that drug gets aboard that dog, he is going to be happier.
Yeah.
Now, yes, it's incumbent on us to communicate the range of options, and particularly as a surgeon, it's incumbent on me. I need to make owners aware of the ups and downs of if we do, and the ups and downs as well of if we don't, because sometimes that's the steering to don't. So we must make owners as informed as possible. But I detected just a little. There's something. Obviously, anyone who tunes into this is worried about and concerned about their pet. So they're coming from a position of they're bothered and love again. But there's just there is a slight atmosphere of that of thinking of these trenches that we're stepping into our trenches. And one thing I really want to get across in this time, and I reflect to communicate this with clients if they've been referred and things have fallen apart, or if I've had difficulty with a client, it's fundamentally the people that you're dealing with in a veterinary practice are those who chose from a fair smorgasbord of options to devote their professional lives to working with animals. And I describe it as working with people in the company of animals. We should not be in two trenches, the opposite either side of some no man's land riddled with barbed wire. We should be viewing this as two people walking down an aisle hand in hand. We really should.
I think so. I've just tracked another one across. I'm just going to finish with the Patricia one because it's absolutely lovely what she said. And I think it's another quick thing to talk about. My brother is not good at speaking to people he believes are authority or qualified, but he loves his dog to bits. He takes her to a vet because her feet are splaying and she is limping. He's worried, but he is told to continue the Metacam, which if used all the time can cause diarrhea. I'd like to take the dog to the vet, but he won't let me. The dog is covered by insurance. This is really tricky. Just on a tangent, I've got a friend called Sean who really can't listen to people in authority. He gets really annoyed with them. So I had to write him letters. I had to do emails. I had to communicate with him in different ways for him to accept what I was trying to instruct him.
Yep.
You'll notice a lot of people spend quite a lot of money on their websites with further information. A lot of vets do handouts. A lot of vets are now doing clinics with their nurses. In your situation, Patricia, your brother might be better seeing a nurse because that might be less authoritarian. So a lot of practices will offer nurse clinics for OA. Your practice might have another section on its website. It might have leaflets, and it might be able to refer you to, say, a physiotherapist who would be able to do more with the splitting toes, etc. So just a few ideas for you.
It's that for me, that's a communication issue as well.
Yeah.
Vets are not trained psychologists. We do actually pick up an awful lot, particularly if we're kind of person motivated. You know, if you're seeing your consult as an opportunity to put a family back together, where one member of it is ailing, then that's very different from seeing a consult as an opportunity to treat a case of bicipital sign of whatever fancy name, and it's a different mindset. But we've got 10 minutes or 15 minutes, 20 or 30 in a referral situation. If we're starting from a complete cold base, it takes time in any conversation, however aware you are, to try and size up people. You know, what's the most effective form of communication going to be here? Sometimes often I start off down on the floor playing with the dog, because I can talk to the client and the dog can interact with me, and I know how to interact with dogs, and we can develop trust. We can develop trust with owners as well. But if you can communicate, Patricia, with your veterinary practice and say, look, this is the situation, to have that heads up beforehand, then maybe we don't have a table between us in that consult. Maybe your vet is sat down when he comes in. Maybe in the manner of our communication, you know, I'm being quite assertive in the manner of communication now, but if I was to lean back and be very much more sort of conciliatory and make it much more of an equal transaction, then you can set people at their comfort. And when it comes up, when you detect that in a consultation, I'll share one example. Once had a patient referred, and the lady brought along her child, and her child was maybe 12, 13, but it was a chap who came straight in, very sort of assertive, and asked some really quite narrow questions. So, are you going to do an operation? Are you going to do so? And there was clearly, I'm not a child psychologist, but it was a slightly unusual form of communication. So in that consult, I spoke to that chap and explained everything that he was asking, and then explained some further things, whilst Mum was listening.
Yeah.
And that actually, in a slightly different triangle, she was going to be, she was going to really struggle to absorb the information that I wanted to impart if she was also concerned that her son was unsettled. So we did things in a different triangle, and actually the communication went really well. He came up and sat on my stool, and we had a look through the computer and stuff like that. But give us a heads up, and then we can. Sorry, give us a heads up, and then we can adjust our communication with you.
I think what you're trying to say is vet practices are very flexible, and my really big advice is phone up first. Tell reception your situation. So it isn't uncommon that we'll have a message saying, my son, he's got a form of autism, he's really attached to the dog, he's not going to take any news very well. And I'll be like, okay, well, that's fine. How would you like us to do this consultation? And it might mean that we delay it a few days, we might have a double, it might be the last one of the surgery. give us the heads up. Okay, it's really important.
And also often, if there's any sort of communication or unusual communication like that, then just as Patricia said, she knows what works best for her brother.
Mm-hmm.
She knows what to avoid as well. And if that was the consult where someone came through, they're running 5 minutes late, they're just pulling on their white coat and they bluster in and they call through someone through and they speak a little urgently, and they know they're late or hectic or something like that, then that could be absolutely smash the wheels off, and the whole situation is not gonna work from the outset. But,
Your descriptions are amazing. They're not normal. Smash. We're going to go into this question because I flagged it and we didn't answer it. Louise, Colin, what is your view on joint supplements? Woo! Over to you. I'm sitting back.
They're so popular, aren't they? I don't know why. I have situations where owners want to do something, and joint supplement kind of comes with the concept that I'm doing something and I'm going to do no harm. So on a mental sort of graph or equation, we've got upside, which I think is very much inflated, and we ain't got downside. So it's a natural thing for owners to choose, and they're available.
Can I give you?
You can get clients massively on board by saying we'll just do joint supplements. Okay. But I absolutely maintain that in terms of efficacy, and the phrase I use with clients is, yes, we stock them in the practice, but I do not prescribe them.
Right. Okay.
If they don't sit on the left hand of the really vital stuff to do, they sit on the, if you want to do something else on top. That's yeah.
Okay, so for an owner who has their beloved dog, and let's say 12-year-old Springer Spaniel, really beginning to show signs of aging, which we know is likely to be pain, they want to do something, and they want to do something in an area that they have no understanding. They've never been here before. They haven't got a medical degree. They haven't got a nutritional degree. They haven't got that kind of ability to go, yes, this will work or won't work. So they will trust what is very well marketed. And there's also in that your head, you're saying no one would ever make something that doesn't work. You know, why would you go to the great lengths to make this product and to market it so well and disseminate it really well? It must have some evidence of working. And they know more than me. I trust them. They know more than me. They're readily available. You can purchase them quite quickly. You feel like you're doing something, and I can totally relate to that. You won't believe half of the things that I did for Holly on sheer desperation. However, and we always seem to get everybody's bad side, there isn't a huge amount of efficacy about it. So when we tell people, they always get a bit angry at us. We're like, no, we're trying to do you a favor. There isn't a huge amount of efficacy. So if you're an owner that can afford to do it, then please do. You know, please do. But if you're an owner that goes, actually, by purchasing this supplement on a regular basis, I won't be able to do my blood test. I won't be able to buy the prescription diet food. I won't be able to do the hydrotherapy. I'm sorry, in that situation, I would say, you know, use your resources for things that we've got more evidence for. Fair?
There's a finite budget. Even in circumstances where an owner comes in and they says, I don't care what it costs or we're insured or whatever, there's a finite budget of resource to address this issue. There's a budget of time, of owner time, because it's lovely us saying that you should walk in for 5 minutes on the hour, every hour, stop working, you've got to be at home, you've got to do this, that and the other. But realistically, there is a budget of time. But there's a budget of involvement as well. No owner wants their dog to be on 42 tablets per day. No owner wants to be thinking there's this, that, and and the other going on, and they want to minimize the issue. And very often I think we have owners who have from whatever route have gone for the joint supplement. It's an easy decision to make, I think, as the clinician in the consult room, to say, well, this is fairly minor, so we're just going to go with a joint supplement rather than have the non-steroidal talk. But in terms of efficacy, yeah, it's a phrase I use a lot. They are available. They will do no harm. They may help a little bit. Ben Walton, fantastic talk on the declining of the power of evidence. The more they're tested, the less evidence is shown.
Are you friends with him? Can you get him to come and do a Facebook Live? Yeah.
Yeah. No, yes. He came. Yes, I was friends with him at uni and still today. But he came down and gave a talk for Cornwall vets. I attended it, and it was absolutely it was gold. How often do you go to a CPD and sit there for an hour and say every word of this is absolutely wonderful?
We'll get Ben on, but I think, so Sasha, you were saying, are you wasting your money? I think, if I'm really honest, we've got a lot more to learn. And I think in many ways, the supplement industry are a bit stuck, because there are some really good supplement providers who really are trying to put clinical evidence behind them. They are trying to ensure that their product is what they say it is. They do make sure that their contents are consistent, reliable, traceable, well-produced and safe. But there is a myriad of companies out there that don't. And unfortunately, they all get lumped together. So what I will do is I'm going to put a link at the end of this to Stephen Fox's recommendation, which is a claim, which is all about these tips of trying to choose an appropriate supplement. We say this every time. We know that omega-3 fatty acids and marine-based source, cold water, fish, we do have more evidence that they have a beneficial effect.
I'm wholly afforded that as well. Yeah, the Hill's JD diet. I even in mentioning a dog food, your next phrase has to be, I have no involvement whatsoever, or whatever. And sometimes people, if they've got confirmed views about feeding, then that's not a discussion that's going to go further on. But if you're choosing one brand at the moment and you're not really bothered or whatever, then I explain that the JD diet costs more. It costs the equivalent of food plus a joint supplement, but the omega-3 fatty acid support, and sound like I'm eulogizing Ben here, and he's a fantastic chap, but he's done some analysis onto the actual content of them. And so Hill's JD diet is something that I do endorse in the consult room. And I, if anything, I try and steer the conversation about joint supplements to say, well, I'm not going to endorse any of those, but this one particular omega-3 fatty acid, blocks arganase, useful, help. Yeah, not going to rock the world, but we're talking about multiple things that can improve our situation by 10s and 20s and 30%, and cumulatively that can add up to quite a bit.
I use that way. So I think like Louise has just come back and said, in my own personal experience, a certain brand of salmon oil really saved my boy's life, blah, blah, blah. I think we've got so much to learn about them. And I know that Daryl Millis was on here about 2 weeks ago, and he uses avocado and soybean unsaponifiables, and they did their own trial in-house at the University of Tennessee, and they really did feel that they saw benefit with it. So, but the problem is that you've got some really supportive evidence, and then you've got some quite weak evidence. And when you're trying to be someone like Cam that's trying to go, right, you've got a certain amount of money, you've got a certain amount of time, we want to get the best for you, I will always say, more rugs, less drugs, keep it simple, get the weight off, change.
I like that one.
I know. I know. Hashtag less drugs. It's not an argument, but it's a question that crops up, and it's time. I'm just reading some of the comments on the side there as well. But it's something that crops up, and it cycles round time and time again. There is no shortage of advice out there for people
who are worried about arthritis with their dog, because it's thunderingly common, and everyone feels that they are able to impart some advice on the subject. And it's just the same. My uncle advising my mum not to have pepper and to wear a copper bracelet and things like that. Everyone feels empowered to impart advice. But I will draw for clients the wave of osteoarthritis, where it gets better, where it gets worse, and it's an oscillating wave. I'm trying to keep my hand on the screen, up and down and up and down. And the time when we listen to the chap beside us in the pub, or the time when we go online to research something or to look something up, or the time when we phone our pal who we know had an arthritic dog or something like that, the time we do that is when we're at our worst. Nobody ever looks to change management of a situation when it's at its best. And we know that osteoarthritis is going to do this. There will be good days, there will be bad days. And so if you, and those days will be clumped together. So if you, on a bad day, if you are advised by someone that you trust, if you're advised that what you need to do is dance 3 times around the maypole backwards, anti-clockwise during a full moon, and you do it, then it's going to work. Yeah. And once it's worked, it will be hardwired into it. Well, that worked. So I think what we have to make sure is that we are the trusted source that they go to at that time. Not because we can then ride on the fact that osteoarthritis is going to come in waves and go to and fro, but so that we can get the best advice aboard for our client, whether that's free stuff like dieting, or whether that's expensive stuff like a CT scan and an elbow arthroscopy, or whatever in between. We've got to get the trust there so that they are coming to see us and taking action at that point. I was on my podium there, wasn't I?
No, it's fine. You get your podium out. I'm hoping you're going to get your little placard out soon. We're going to go on to that topic in a minute. One thing we also have to bear in mind is that a lot of these interventions we implement are not just going to be working on the joints. They're going to be working on the surrounding soft tissue. They're going to be working on the dog. The fact that you spend more time with your dog, you put more effort in, you give them a bit of more attention, has a massive effect on their demeanour. So if you've got a dog that suddenly starts getting attention twice a day more when you're giving this pill wrapped in a piece of, oh my God, I'm so loved and this is amazing, my routine's better, etc. So these supplements, there's a wide effect that they have. Let's get to your phrase. I can't not do this because it's just so strange.
I'll take that. Yeah.
Positive way.
It's something. It's for that situation really, and I'm thinking of the booster consult as much as anything here, but where the veterinary surgeon has the dog in the room, and we can detect lameness, or the owner comes in and says, well, it's not an issue, they're not in pain, they just limp occasionally. And the discussion for that, well, there's 2 reasons why you limp. Either it's sore, or in a vanishingly small number of cases there's a mechanical problem where one leg's born shorter than the other, and there's not much else unless I've been there and fused a joint and we've got a gait abnormality. It's either pain or we've got something that's been built a little bit wrong and one leg doesn't quite touch the ground. And communicating, it's that those are our choices. Yes, he's not going out each like I would whinge with my bad back, but there's no benefit whatsoever to an animal, whether they see themselves as a prey animal, a pack animal, or anywhere in between, to say, hey, you know what, I'm not quite tickety-boo. You're going to be the zebra at the back of the herd who's going to get a visitor. So animals are not going to vocalize about an issue unless it is in extremis. Yes, if they've encountered massive trauma, then yes, they'll vocalize. Otherwise, it's us who have to flag that up as actually this is a little bit of an issue. And as vets, we're really good at that if we detect that a dog is drinking extra. Now, owners might mention he's drinking, he seems to be urinating quite a lot. And also, it's many years since I did diabetes and Cushing's and all those things, but there's light bulbs going off in the vet's head, drinking extra, got to do something, and the vet is straight in there, sensitively and communicatively, but that's looking at a big flaming issue, a raging fire that we need to jump on top of. But the situation when you've got a dog who is 8 or 9 years of age, maybe a dog who's 4 or 5 years of age, and they're just showing a slight hind limb lameness, this could be the start of cruciate degeneration, hip osteoarthritis. And so it's an effort of will then for the clinician who's got another 14 consults to see before lunchtime or whatever, who might already be running late or whatever, but we've got to flag that up and identify it. And so the daft phrase or the situation that I use is that Bon Jovi stuff. Sorry.
Oh, no, let me just say something. Isn't this the weirdest thing? When I palpate a dog and I say to them, oh, there's a little bit of abdominal pain here, they're like, oh, right, what do we need to do? But if I palpate the legs or I observe musculoskeletal pain, they're like, no, it's fine, it's just getting a bit old. Yeah. That's crazy. Why would you?
Only digits get age-related arthritis, and just possibly the odd carpus. Any other form of arthritis is a problem, not age in dogs. They don't live old enough for the other important joints to wear out.
I just find it very strange that people will believe something that they can't see. So you cannot see into the abdomen. As an owner, you cannot see into the abdomen, but you trust and believe me when I palpate in there, or you trust me when I've got my stethoscope and I'm listening to the heart or the lung. You haven't heard them, but you trust me on that note. But when I say your dog isn't walking well, it's not transitioning well, its behaviours change, then there's this belief, no, it's not. No, it's just going on. I find that strange.
I think, people, we live long enough for arthritis to develop in later life, and it's kind of it's just accepted that 2 65-year-old men in the pub, they're not having a discussion about whether or not it's which joint and what do you do, I shouldn't have done this and whatever. It's part of life, and we accept it as part of life. I've got a touch of abdominal pain. That's a conversation stopper.
Yeah.
I've got a rattle in my chest, or the doctor says I've got a heart murmur. That's not a, oh, well, happen you'll run it off. That's okay. This is better. And I think that's the fundamental distinction. But communicating that the dogs don't get age-related hip, shoulder, elbow, knee, hock, arthritis. There is something wrong. And if there's something wrong and we can identify it, we can help it. And the mobility to a dog is such a massive part of their well-being. It's so important to them. And people who are unfortunate that their mobility is much reduced, there's many other things that we can do to still gain a very substantial amount of enjoyment from our life. People who are without sight or without hearing or without mobility, there are things that we can do to adapt, and we can still derive significant and huge well-being. But for a dog, so much is wrapped up. Their feeling of safety is wrapped up in their mobility. I know that I can, you'd think that they should probably understand that a pack of wolves isn't going to break into the front room when they're sitting there by now. It hasn't happened in the last 11 years. It's unlikely to happen now. But their instinct, their programmed instinct is such that if there's any danger, I know I'm mobile and I can get away from it. So they feel safe and content through being mobile. Their enjoyment, when is a dog at their happiest? If it's a Labrador, it's the 3 seconds that they're eating dinner or when they're on a walk, when they're mobile, when they're out. So that's the part of their overlap of life with us. Yes, they like to cozy up on the sofa, but still, in most cases, offer them a lead, they go for it. So their well-being is...
Just stop. What you're trying to say is that their mobility is so important to them.
Yes.
That it's our absolute duty of care to make sure that we keep them mobile as long as possible.
Yeah.
Yes.
And if you reframe it, and if you could communicate with your owner and say, would you like me to try and make your dog as happy as possible? What owner in your consult room is going to say, you know what, about 75–80% happy is fine. That'll do.
Yeah. No one would
They're
say
not.
that.
Yeah.
No.
So
Totally agree with you, and that's such a good spin for a first opinion vet. That's a good one. You know, don't you want your dog to just be as happy as he can be? Brilliant. Love.
Which means as mobile as possible for as long as possible, because he's only got one life. It's his life.
Please do
now
it.
or never.
Please
in that
do it.
consult room. You want the placard?
I need it.
Where's it gone?
Go back a bit. Go back a bit.
It's in. Bon Jovi. Yeah, cue the music.
Have you got it?
It's my...
I don't think anybody's going to forget this one. Luna's going, what is going on?
His living is so wrapped up in his mobility, not his being alive, but his actual living, his getting every moment out, every enjoyment out of this is wrapped up in his mobility. He doesn't have mobility without his comfort. If he's got arthritis, that's taking that away. It's life inhibiting and it's life shortening to a degree. If we have to make a decision at an earlier stage when we otherwise wouldn't. So as the vet, yes, you're pressed for time. There's all these other things going on, but you look at that little face, that little furry face, and it's his life. This is the moment. We're not going to get loads of opportunities to pick up arthritis. Not if it's a booster, not for another year. You pick it up now. You get that owner together with you. You meet them in no man's land. It's now or never. And you can secure a better life for him for...
You know that I'm using this. So we're doing the Hills OA Roadshow again this year. So we did 6 events last year and we've been invited back. We're doing 12 this year. Right. I'm using that. Do I have your permission? Oh, okay, good. At that point, bear in mind that we've hit nearly 60 minutes. Let's do our 10 top tips. And everybody loves you. So you're going to be coming back because that's just hit the spot perfectly. Right, let's start our 10 top tips. You are going to be number 9 because that means that you end up with the ultimate tip at number 1. So I'll start at 10. And it's the easy one. And it's something that we've covered. Manage their weight. Now, people keep putting photos of their dogs up, which they're really proud of, and that's why Holly's Army is there. But we can see a lot of them are overweight, but you guys are putting photos up going, oh, this is my lovely dog. So you obviously can't see that your dog's probably carrying a bit of weight.
Bit too much love going on.
Yeah, well, a 9 out of 10 owners cannot see that their dog is overweight. So Holly's Army is currently offering free visual body condition scoring. So if you go and join Holly's Army, which we'll put a link up for you, the lovely, lovely Lindsay is taking photos. You email her the photos from above looking down at their back and from the side, and she will tell you if you're on the right track. And then she will encourage you, if you're not, to go and see your vet, to go to a nurse clinic. So top tip number 10, weight control. If you're worried, go to Holly's Army. We can help you out. Number 9.
Yeah. How can you tell if a dog is at its correct weight because an owner's brought it into you saying that they're worried that they're underweight?
Yes.
Right. Number 9. Top tips. Non-steroidals are our friend. There we are.
That's a hashtag.
Yeah. Non-steroidals are the equivalent of Severus Snape. He got a bad rep for so long, all through the Harry Potter movies. Actually, he's the bloody hero, and he doesn't deserve it. It's not fair. And number 8. This is yours.
Number 8.
Help! I got to think of a number.
I don't know what to say now. I think you've outwitted me. Number 8 for me definitely is start getting those food feeders. You know, those interactive feeders, those food maze bowls, those mats, the licky bowls, the snuffle mats, because that is a tool. It keeps them happy, it keeps them distracted, it keeps them mobile. When Holly was really at her worst, even her just being in stern or leaning forward on the licky mat was moving things. And I needed her to keep moving. If she laid still for long periods of time, then she'd stiffen up and it's really horrible. Use these tools. They're cheap, they're safe, and they make their quality of life so much better. So that's number 8. Number 7.
Okay. Money is not the answer. It may be that effort or a redirection of effort will be the answer, but in the treatment of arthritis, it is not the case that the escalating costs or efforts go hand in hand with efficacy. Now, that's not saying that there aren't some important things to do that don't work, but just because it costs a lot, don't mean that it's better than losing weight, adjusting exercise, going to hydrotherapy and things like that.
I love that one. And that's really close to Cam's heart, because a lot of attention is given to things that get a return for the creator of the information. So when you see people that put a lot of effort into information and online content, they're doing it because they're getting something back. And, you know, these freebies, you know.
Yeah. And to be fair, vets are in with that as well, because we have this crazy unnatural business model that the more stuff we find wrong to do, the more income comes into the practice. So actually, a way to really establish that vet-client relationship, and particularly as a referral clinician, you know, we've just met. Hopefully, you've had a good piece of sort of a report on me from your referring vet, saying, you know, go and see Colin, look after you, and things like that. So there's been a bit of introduction that way. But you've just met. You're just starting in with a relationship, and it can be very hard to say, well, actually, you weren't aware that this was so much of a problem. Partial tear cruciate ligament being the primary example. You know, it's very easy to say in those situations, we'll have some anti-inflammatories for a couple of weeks and see how it goes. And it will get better in those couple of weeks, and it might not flare up, whatever, but we've got a cruciate rupture coming down the line. And if we do our surgery early on, then we can optimize our outcome. We don't have to journey into more advanced osteoarthritis before we've done an intervention. But for the veterinary clinician to try and establish that, to introduce that sort of trust me on this, and you know, hard work in the consult room to do so. You've really got to be focused in on it. But often, if we're advising and starting from a place of, well, you don't need to do that, or don't need to do this, that, or the other, then you can start to establish that rapport. And just because it's glaring for us, look, this dog comes in with an elbow effusion. 2 seconds after putting my thumbs on his elbow, I know that he needs a CT scan. That doesn't mean that we can say straight off, what you need here is a CT scan, whoop-de-doo, see the lady on the desk, sign it, whatever, book it in. So we've got to take the time, even if it's something that's perfectly straightforward to us with our knowledge and our background. We've got to lead the client on the journey towards that, and that takes time. It takes communication skills. It may mean asking the client to sit down so that they switch to receptive in the consult. Your body language then switch to receptive. There's all sorts of ways that you can do to effectimize your communication like that.
We're going to do that. We're going to do
that. There's
that.
a point in there somewhere.
No. You'll come back and we can do that. So going back to tips, number six for me, if you see something, then it probably is there. So when people go, oh, he was lame a few days ago, but it's cleared now. And if you then see that they're lame again a few months later, no, but it was only short-lived. There generally is something there. And something that I find with the work that I'm doing now is that they can actually walk pretty well, even with quite sore joints. And when you actually do push them for a full flexion extension, there's discomfort there, but they're not too bad walking. So as an owner, if you're seeing it, it's probably quite significant. So don't leave it. Go to your vet and talk.
Yeah.
Don't wait until it's a really massive problem, because that means that it's going to be really well set in by then. And as with all the other Facebook Lives, the people like James Hunt last week, Matt Gurney, central sensitization is very, very common. And the longer you leave a pain state, the worse it can get. So catch it early. Number 5.
Now, look, I think I was going to go back to my oscillating curve as well, okay, which I think you've probably covered a bit in that point. But there is so much there's so much advice that's out there. We know that we have this up and down. We know that you can ride the curve of that. We know that if someone says, dress your dog in a purple collar, the time you're going to be asking for that is when you're up there, and you will feel that it's worked afterwards as you dip down there. So it's to say, please access your veterinary practice as your point of information and develop that relationship. If you don't feel that there's quite that relationship with one clinician or one clinician's style, by all means ask to speak to someone else, to see someone else. But your veterinary practice is your friend. Let's walk down the aisle to the altar together. Let's not be in bloody trenches either side of some barbed wire.
I need to come to your practice. I think it must be absolutely mental. Number 4 for me would definitely be if you can afford it. If you can afford it, then do have an appointment with a physiotherapist. Do put that into your treatment plan, because since I've been doing more rehab and physio, I'm just like, oh my God, there's so much that can be done. And that's non-pharmaceutical, non-surgical. And we as a profession do not give that information out readily because we're not trained in it. So for the around about £50, you can see a physiotherapist. They'll be with you for more than likely 45 minutes to an hour, and they can go through a lot of interventions that will help, such as heat packing, cold packing, gentle massage techniques, home therapeutic exercise plans. Absolute gold dust. Number 3.
Stretch on from that, hydrotherapy.
Yeah.
That sits on the left hand of the things that really work. Hydrotherapy centres with appropriately trained hydrotherapists working within them. I suppose I'm of that generation where if you're spending money on something, you want to see the benefit. And there can be a little bit of a mindset of, well, he's just doing a bit of swimming, isn't he?
Yeah.
And he wasn't in for very long either as well. So, but actually, so I have that similar sort of instinct of, if we're spending money on something, then we want to see the benefit.
I'm going to show you something. 2 seconds.
Yeah. If we're spending our money on something, we want to see the benefit. And I can speak absolutely with complete passion about the efficacy of hydrotherapy. It makes a vast difference to osteoarthritis cases, makes a vast difference to post-operative outcomes as well. So that's something I believe in and I speak with that passion about in consult. I can't read that. I've got varifocal contact lenses in. I can't. Oh, there we go. Yeah, good.
Okay, this is like a vaccination card. So it has a structure for vets to follow to make sure that everything is covered in your consultation. But so much more, because in the back we've got the canine brief pain index. We have also got complementary therapy. So if you are seeing a hydrotherapist or a physiotherapist or a massage therapist, they can write their findings in the same book as what the vet's writing their findings in. So people can talk to each other, and we have a team. The good thing about this book is you only need to buy it once, because all the pages you can download and print off the website. So it's one tiny, tiny bill. Also in it, it's the good day, bad day diary. So you can monitor your dog more closely. So there's that. Another thing, while I'm at it, have you seen this? Check this out.
Anti-slip tape.
Yes.
No.
Yeah, well, there you go. So that's to try and get owners to start realising that modifications around the house are really important. So if you've got a dog that is struggling and they are slipping and they're tripping over the back step and they perch their foot on that PVC door frame because they haven't got the ability to step over anymore, this is designed to try and get owners to start realising that these things are important. Now, the reason I say this is go back to the beginning of Facebook Live. People believe that if you take the time to carefully mark it, comes with loads of information, comes with all the QR codes, it must work. So they're going to buy it because it must work. But what that does, once they start using things like this, they start changing other things. They'll put the rugs down, they'll buy the ramps, they'll change the bedding. It starts the ball rolling. So that's available too. There you go. Didn't know that, did you?
No, I didn't.
No. Number two for me is always the same. I wish that I had known sooner. I wish that I had been aware sooner. I also know that I probably knew, but I didn't have the conviction that it was really something there. So Holly, a number of times, was a little bit limpy on her forelimb. It'd be months apart. But hers was cervical disc disease. She had a collapsed disc in her neck. She had lumbosacral disease. So, number two is tell people about this. Talk about it. Get in the park. Talk to the dog walkers. That's why we created the hashtag Your Dog More Years. Because it is fun, it's friendly, it's bouncy, it says what it means. Your dog more years. It's fun. Talk about it. Get the hoodie. Get the hats. Get the snooze. There's all these stuff that you can buy, little bum bags. We have Your Dog More Year bum bags. Talk about it, because other people want to know, and they will take it better from you than often the white coat effect. So we've told you about how people come in.
Never wear a white coat.
Never wear a white coat when you're wearing a walking your dog. But do talk about it.
White coat fever.
The biggie. Go for the biggie.
The biggie. If there's an issue that's arising and it's early on in the animal's life, then let's hope that there is a surgery that's applicable.
Yes.
Let's not be averse to a surgical procedure. Let's not go in hoping to avoid, because actually in this situation, if there's an issue in fairly early life, you've either got a situation where, you know what, you're just going to ride out arthritis, or there is something that's going on that we can intervene, modulate, improve, and do something early on. So actually, for the conditions where it's appropriate, be open to an early surgery. And that goes for vets as well as clients. It can be a very difficult conversation to say, we've got a very slightly limpy 3-year-old Rottweiler who's just a tiny bit off on their back leg, and he hopped a little bit, he had a non-steroidal, and he was better the next day. That's a difficult place to go from to doing a TPLO surgery. But actually, in those cases where it's appropriate, and you need to talk this through with the vets, whatever, but vets be open to introducing it, and if it's referral or in-house, whatever, be open to going the extra mile for those cases that warrant it, where if we can get in early, we can do our best long term.
But I think that you're right. I think that's applicable to everything. If a physio could get in there earlier, you know, I know, being a bit of a rehab person myself, it's nice. This sounds wrong, what I'm about to say. It's nice when you have a really crippled dog and you make them walk better, and it's very visual, and they're like, "Wow, that's amazing what you just did." It's less persuasive to the owner when you've got a dog that's very slightly lame and you make it very slightly better. But for the dog, that's really quite important. So that dog's going, "Thanks, high five." But to demonstrate how important your intervention's been is a lot harder for that owner to see. Doesn't mean we shouldn't do it. So all of these interventions, let's embrace them before the dogs actually have to go through a lot of suffering before the owner goes, "Oh, it's really bad now. We need to do something now."
Yeah. Well, in simple and that simple case of cruciate ligament, if you can detect that in your first opinion practice, if you can detect that as a partial tear, you've done a bloody good job.
Yeah.
Particularly if you can then lead that on to surgery.
Yeah.
Because that dog is going to have a need for a surgical procedure, and let's say that everything else is in place for a surgical procedure to happen, you can either have it without a cruciate ligament, or you can have it with some cruciate ligament remaining, or the beginnings of a cruciate ligament deterioration. It's a progressive condition. It is going to happen. You can phrase it as you're going to need to have a TPLO. You can wait until the joint's further deteriorated, and then it's an easy referral because this dog's completely off his leg or showing really marked lameness. Or you can go through the more awkward or harder yards, early doors for the early detection, get them in for their x-ray, pick it up at the very earliest. If we're then looking at a graph going on from that point, we're looking at a much more comfortable dog through a hell of a lot of years the other side if we can address these things early.
It is.
But it starts in the first opinion detection.
Yeah, and I think one of the things that I find really frustrating, and I'm sorry profession if you hate what I say, but a number of people have said, "Oh my God, arthritis is so boring." And I'm like, oh my God, no, it is not. It is so complicated, and it is probably, this part of my career is the most challenging because there's so many interventions, there's so many things to consider, there's so many skill bases you need to develop to really do this disease justice. So on that note, thanks, Colin. I think that went really well.
Thank you for inviting me.
Well, everybody would like to say thank you to Colin. I'm sure if he gets loads of thanks, I'll be able to persuade him to come back. And you might choose areas that he can introduce another Bon Jovi song. You know, why not?
We're moving on to Def Leppard, I think.
Okay, cool. That's fine. That's fine. I don't want to go. Cool. Right. So, guys, thanks very much for your time. And our next Facebook Live is Tuesday with Sean McCormack's coming back. And he has spent Christmas going through the clinical evidence supporting different supplements, and he is going to talk about his findings. So, that's a deep breath situation.
Right in my diary.
Yeah, Tuesday, 7 p.m. And then we've got the amazing Louise Clark, a pain specialist from Davies, joining us on Thursday. Busy week. Anyway, see you later, guys.
Cool. Right.